my career, I actually started as a direct support professional. I was living in Iowa at the time. I worked with children who were autistic, and really the opportunity to work with children was what drew me to it. Once I fell into the field, and it truly was a stumble because I was in a new place. I didn't have, I had truly no friends, no really point of reference where I was at. And I read the job description and I was like, well, here I am, a fresh college graduate. I can do all those things that they're asking of me. And when I went into the interview and I got to watch a video and kind of really understand fully what it was that they were asking of me. I got to shadow a group of children and I was like, okay, yeah, I want to do this. Through that agency those were my ladders, and that was my vehicle to move into an administrative role. So I continued to do so, but I started working with adults in that aspect, and I actually was housed out of our vocational training program. So I got to see both sides of it, the vocational supports we offered, the residential supports, and then I moved to Massachusetts. And in Massachusetts, I also, again, I was in a directorial role there as well. But, a different state, a different playing field, different, aspects, we didn't have day support programs within our own agency at that time. And that was something they were trying to get off the ground and going. And, in state-wise, the way in which policy was addressed was different than Iowa, of course. And then eventually I moved back home to Ohio, which is where I am now. And I stepped into this role in the vocational piece, and which was really a first for me. So another change. So it's been humbling completely to step back and to go back into those shoes that I once was so anxious to fill. I thought, well, what if I do something wrong, or what if I say the wrong thing, or what if somebody's upset? How will I address it? And it's just so interesting that you become so comfortable and you become, so longing for that direct interaction, myself included. I've been very fortunate in my career to be able to move to such a level and such a degree. And truly, I don't think that I'm done. I'm actually currently pursuing my master's in public health and policy and management. And what I really want to do is impact that greater level change from a policy provision standpoint. So I love working with the individuals and I love working one-on-one with them. But truly, to go back to that DSP role, it's been a blessing at this time, but I want to continue to use this as a vehicle forward to really impact a greater, sort of vibrations of change. And working with them one-on-one, it's great. I know that I'm each day that I'm in there, I'm giving them the best day that I possibly can, but I don't want to just touch the ones that I'm working with. I want to, be all encompassing in my overall career goals with it.